All right, so far I've talked about, again, this, you can kind of think of what I've just talked about as primary aging. These are the things that are going to happen for most people, even if you have a really healthy lifestyle. But in addition to that, there are more severe cognitive impairments that can come during this time that I would say are a result of secondary aging. So either a genetic predisposition or poor life choices that result in more severe cognitive impairments. There's a class of these called dementia. So dementia is a class of different disorders and diseases. There's about a dozen of them, but the two most common are Alzheimer's disease and what's called vascular dementia. All these dementias involve impairments to thought and behavior that often disrupt daily life. And like I said, two most common are Alzheimer's, which is about 70% of all dementia cases, and vascular dementia is about 15%. There are also some misdiagnosed or reversible dementia. So this is basically where someone's showing some of the symptoms that are associated with dementia, but it's actually due to other issues. So for example, if someone's suffering from depression, then they may show some cognitive impairments and things that kind of mimic Alzheimer's disease. Some medications have side effects that can cause cognitive impairments. And then there's other diseases that involve temporary mental symptoms. Environmental changes and social isolation can also trigger symptoms that are similar. And so it's important to have adequate mental health services and to get proper referrals from doctors in order to, properly diagnose dementias. Also, most dementias are diagnosed through a process of elimination. There's not really good tests that can sort of verifiably for sure diagnose something like Alzheimer's disease. It's more ruling out other causes and then figuring out, okay, really the only thing left that this could be is Alzheimer's disease. The only way to definitively diagnose Alzheimer's disease is through an autopsy done on the brain after death. And so it's, again, sort of process of elimination to try and figure out. Some of the early symptoms of Alzheimer's disease are progressively worsening memory symptoms. They may start with just, forgetting names, faces, dates, appointments, etc., but then it gets worse and worse. There's also personality changes, increases in anxiety, particularly in response to uncertain situations, and they may also have aggressive outbursts and depression as well. Some of the symptoms that continue as the disease progresses, there may be motor and speech problems. People particularly have difficulty with fine motor movements and purposeful movements, so that can make it really difficult to get dressed, to shower, to eat, etc. So they may need help with all of those. It can also result in sleep disturbances and delusions, and as it progresses even further, you can have full loss of recognition of objects and familiar people. Some of the changes that happen in the brain, you have what are called neurofibrillary tangles. So the neurons in the brain kind of collapse in on themselves, and it causes these fibers to sort of tangle up. And those contain this protein called tau, which is an abnormal protein that kind of builds up. You also have a buildup of something called amyloid. Amyloid is basically this deteriorated protein that can build up and create plaques in the cortex. During sleep, actually, your body kind of cycles waste out of your brain and cycles out some of this amyloid. So there's some evidence that having sleep disturbances early, like in your young and middle adulthood, can contribute to a risk of Alzheimer's disease. Because if you're not getting enough sleep, then that sort of waste system in your brain isn't flushing out the amyloid, and it can build up. There's also deterioration of synapses, so the connections between neurons kind of break down. And so all of that results in some of the cognitive and motor disturbances that you see with Alzheimer's disease. Some of the risk factors, there is a genetic predisposition, so Alzheimer's disease can run in families. Identical twins are more likely to share it compared to non-identical twins. Eating a really high-fat diet, having a sedentary lifestyle where you're not very active, being overweight or obese, smoking, diabetes, head injuries, etc., all those contribute to a risk factor of developing Alzheimer's. Some protective factors, receiving an education and engaging in complex cognitive activities has been shown to reduce the risk slightly. Eating a Mediterranean diet. Mediterranean diet is basically high in vegetables and fruits, a lot of fiber, some moderate drinking of red wine, and also really lean meats, particularly fish. That's what characterizes the Mediterranean diet, and that's been shown to actually reduce Alzheimer's disease risk. Having stimulating social and leisure activities and regular exercise also protect. Some of the help that is available for victims of Alzheimer's, there are drugs. There's no like cure to Alzheimer's disease, but there are drugs that help increase certain neurotransmitters that can reduce some of the symptoms. It's also been shown that insulin therapies can help. So one thing that sort of accompanies Alzheimer's disease is people often have a decreased sensitivity to insulin, particularly in the brain. So kind of like what you see with diabetes. And so insulin therapies can help as well. And then also programs that help with those who are in a caregiving role who are supporting the person with Alzheimer's. So family intervention programs can teach about the disease itself. They can teach family members, effective strategies for dealing with some of the memory issues, can teach them caregiving skills, etc. Those have been shown to be helpful. And then in addition to that, trying to avoid changes in living conditions or daily routines, because people with Alzheimer's can get agitated whenever something changes, and also because they have difficulty kind of learning new information and remembering that, it can sometimes be helpful to sort of avoid those changes. And then the other type of dementia that I said is second most common is called vascular dementia. So this is where you have a series of strokes that produces a kind of step-by-step degradation in mental ability. There's some genetic factors that contribute to that. If you have genetic factors that increase your risk of high blood pressure, cardiovascular disease, diabetes, etc., all of those increase the risk of stroke, and so that increases the risk of getting vascular dementia. And then also cigarette smoking, heavy alcohol use, and psychological stress also contribute. Most cases are caused by atherosclerosis. Remember, that's where you have a buildup of plaques within the arteries. And so prevention is really critical. Once a stroke occurs, loss of function is pretty common. So it's also really critical if you feel like you're suffering from a stroke or someone you love is suffering from a stroke to get to a hospital as quickly as possible. They do have methods for reducing the impact of strokes, but most of those have to be administered within a pretty short time window. So if you ever experience any symptoms that you think might be a stroke, it's really important to get those taken care of very quickly.